Hi, my name is Dr. Samuel Harmon, and I represent Community Physician Network Ear, Nose, and Throat Care. My father was an optometrist, and I just always wanted to be a doctor. I originally wanted to be an ophthalmologist, and found ophthalmology a little too boring for me. So, because my sister's deaf, I had some interest in the ears, and that's how I ended up doing it. I like to boat, water ski. That's pretty much what I spend my time doing when I'm not at work. Being able to fix things, fix people, make them feel better. You know, they come in miserable and they go out feeling better. That's a rewarding thing. The most common things we do are take care of children with tonsils and adenoids. We do a fair amount of thyroid surgery and a fair amount of sinus surgery and nasal surgery. Well, basically how I explain it to patients is it's a device that I can use in surgery, and it's basically a GPS for inside your head. Through the use of a special CT scan and a computer, we can reference that to you in the operating room. I can take an instrument, put inside your nose, and within a millimeter of accuracy, I can know exactly where that instrument is through the entire procedure. And because of the tight confines of sinus surgery between the brain and the eye, that gives us the ability to do a better job and a safer job of taking care of what needs to be taken care of inside your nose. Well, the image guidance doesn't really save you much in recovery. What it does is allows you to do a more complete job in a safe manner. The techniques for fast recovery have already sort of been worked out in that arena. We try to do the minimal amount of removal of tissue so that the healing process is quicker. We also use something called platelet gel, which is something we make from your own tissue. It's like tissue glue, and it has growth factors in it. It reduces swelling and it speeds the healing of the tissues and the surfaces inside the nose, and so it shortens the recovery time. Typical recovery is about a week, but people aren't down for that week, but they feel like sort of like you have a cold. First couple days feel really good, then they get a little more congested and have trouble with that, and then they come and see us and we take care of that, and then they feel pretty good. I do have one gentleman who came back after having all this done, and he was one of my early patients using the navigation, and he said, "Doc, I hope it was okay if I went out and played 18 holes of golf the day after we did this." He said, "I felt so much better, I couldn't resist." And he was fine, so I said, I guess it didn't hurt him. So we have some people that really don't have much trouble with it, and a lot of people don't take any pain medicine because they swear to me it doesn't hurt. They're typically treated by the family physician for sinusitis, and they don't come and see us until it's a prolonged issue. And the first thing you do is a history and a head and neck exam to make sure that you don't find any obvious causes. You want to make sure they don't have allergies, because we can't treat allergies with surgery, so we want to address that beforehand and take care of those things. Because oftentimes, I tell most patients, 50% of the time, I can solve your sinus problem without surgery by treating your allergies if you have significant allergies. So we go through all that, and once we've done that, if we're still not getting the results that we want, then we start talking about having surgery. We do an endoscopic exam here in the office, which is the same device that we use to look in their nose in surgery to see what their anatomy is like, and then obtain a CT scan to use in a computer-aided device. The most common reason now for tonsillectomy, by and large, is not chronic infection, but it's sleep-disordered breathing. So they'll come in and say this child snores, is a restless sleeper, has nightmares or night terrors, wets the bed frequently, and those are all signs of them not sleeping well and breathing well at night. If the history is real straightforward, then we'll go ahead and take the tonsils and adenoids out without doing a sleep study. If there's any question about whether that's the issue or not, then we can do a sleep study to confirm that before we do surgery. The optimum time to have your tonsils out is when you're 3 years old. That's when it's the easiest. A lot of 3-year-olds never miss a beat after they have their tonsils out. parents accused me of not doing anything to them because they went home, ate at McDonald's, and that was the end of it. And the reason for that is they're revved up, they're growing, and so they heal a lot faster than somebody who's 10 or a teenager. They have the same sore throat, it just doesn't last very long. They can expect about a week's recovery and a couple of days of pretty significant discomfort, which we manage with ibuprofen and narcotic pain medicine. But the key to it is good hydration. You have to encourage them strongly to keep drinking because they don't want to, especially young. The other thing that we do a lot of is thyroid surgery. And we work with endocrinologists in the network to take care of people with thyroid disease that need surgical care. And I enjoy that work. It's fun work. Typically, a person would have a nodule in their thyroid that had been discovered by their family doctor. And maybe they had an ultrasound for another reason and they discovered they had a thyroid nodule. And they come and see us, we evaluate them, and do a needle biopsy to decide whether it's cancer or not, and then determine whether or not it needs to be removed. And a lot of that's based on size and their symptoms and those kind of. It's a difference in training. They're trained through an internal medicine program, and we're trained through an otolaryngology program. Typically, otolaryngology allergists, otolaryngeal allergists are a little more aggressive with advancing the dose of the antigens. We do skin testing for environmental allergies. We also do skin testing for foods, and we do some testing for chemicals, for volatile organic chemicals. Not as much of that. Basically, we do our skin testing on the upper arms. We don't use the back as a traditional allergist would. And then we review those results with the patient and recommend a treatment plan, which usually involves weekly injections on a time frame of 2 to 3 years to resolve their issues. We don't require referrals, so we take appointments for patients, and a lot of our patients are referred by other patients.